last talk that I have, and I sort of described it now for something completely different, it's not completely different in that there were similar findings discussed from Bristol Myers Squibb drug last year, which now goes by the name nivolumab, but this is a drug that is a PD-L1 inhibitor from Genentech. Dr. Spiegel presented the data. PD-L1 is on the surface of many tumor cells and can be seen on normal cells as well, but the prevalence on tumor cells is shown here. This is just what staining looks like. The idea is that PD-1, which is on T cells, interacts with PD-L1, and that when those two things interact, PD-1 and PD-L1, the result is that the T cell does not react against the tumor. And there is a thought that tumors basically hijack this mechanism. This is one of the mechanisms that help prevent, presumably, autoimmunity. And the thought is that tumors basically hijack this mechanism, showing a high degree of PD-L1 expression, and as a result, the immune system doesn't destroy the tumor. In an ideal world, of course, the immune system would destroy the tumor. This was a phase 1 study, which means that on some level they were looking at different dosages, but at some point they just enrolled a whole bunch of people in this study, and they were looking to try and find the maximum tolerated dose. Now, I haven't shown the safety profiles for each of the drugs. In part, I'm trying to stay within time, but overall, this safety profile actually appeared to be pretty well tolerated. There were certainly many patients with cough and fatigue, but things like cough and fatigue are fairly common in cancer patients, and oftentimes it is somewhat difficult to determine what is related to the drug and what is related to the disease itself. In terms of more serious events, there were no treatment-related deaths. Inflammation in the lung, or pneumonitis, which has been a concern with this class of drugs, was really not seen with this agent.